Welcome to Thursday's edition of COVID-19. Korea's daily tally has surged above the 2,000 level yet again, following a record high about 8 days earlier. Also against this backdrop, plans are in the works to further open school grounds, and we delve into those plans here and abroad later on the program. And speaking of abroad, COVID-19 concerns have been pushed aside in Afghanistan as chaos continues following the Taliban's abrupt rise to power. We start now with our Kwon So-ah and the pandemic coverage. So let's begin here in the country.
Right, Sunny, as was cautiously predicted on Wednesday, cases have surged to above 2,000 on this Thursday for a change. 2,152 is the number we're seeing as of 12 a.m. And that is 350 cases more than the day before, as you can see here on our graph. And that also means that almost 350 more domestic transmissions were reported, as the number of imported cases remains the same as the day before. Now, we're seeing a surge in particular in Gyeonggi-do province here, which has risen to the 600s, also over 570 in Seoul, and a surge in the city of Incheon as well. Down in the southeast, we're seeing triple digits in Gyeongsangnam-do province and Busan, both also seeing more cases than on the day before. And in total, Korea has surpassed 230,000 infections in total, and a double-digit figure of fatalities were reported in the past day. 13 people have lost their lives due to COVID-19 in the past day, and that is the highest death toll we're seeing during the fourth wave of the virus here in the country. So owing to the overall rise in infections here in the country, a health minister official said that 53 people have lost their lives in the past week, ending this Thursday, up from 29 the previous week. And with that, officials are stressing the need for fast containment of the virus, and also to make sure that unvaccinated seniors do get their shots.
Right, and speaking about vaccination, so the late registration for those between the ages of 18 and 49 begins on this Thursday, right?
That's correct, Sunny. So following the last day of the 10-day rotation booking system that ends at 6 p.m. this Thursday, late vaccine registration kicks off 2 hours later at 8 p.m. So people aged 36 to 49 can make their reservations beginning today until tomorrow. And then we've got those aged 18 to 35 who can do the same from Friday to Saturday. And also people who missed their chance they are deciding whether to get the vaccine. Bookings will open for all of them beginning on the 21st until September 18th. And also people can make changes to their earlier reservations beginning this Sunday on the 22nd. Meanwhile, the country has surpassed now 24.3 million of people who got at least one dose of COVID-19 vaccine, and 10.8 million have been fully vaccinated. That's around 21%. Over in the U.S., meanwhile, the country is going to administer booster shots for every eligible American beginning on September 20th, meaning third shots will be offered to them starting 8 months after they have received either Pfizer or Moderna shots. And the country is also going to make a recommendation for those who got the single dose of Janssen shots in the coming weeks. And finally, let's take a look at the number of new COVID-19 cases around the world. We've got 715,137 new cases, which has raised the total to 210 million, and 4.4 million people have so far lost their lives, with an additional some 10,000 people in the past day. And those are the updates I have for now. I will see you back after the government briefing. Sunny?
All right, so thank you for now. Right, on the international front, shocking scenes of people clinging to aircrafts flying out of Kabul airport have been making headlines this week and understandably overshadowing updates on COVID-19. Now, the dramatic turn of events come as the Taliban swept across Afghanistan, that is, in 10 days to grab control of the capital city. For more on this, I have Hamid Yousafzad joining me live from Kabul. Hamid, welcome.
Hello and greeting. I appreciate my colleagues for coordinating this program to be live and deliver our message from here, Afghanistan.
Of course, Kabul, you're most welcome. Now, Hamid, the alarming abrupt takeover of Kabul by the Taliban this past Sunday, that is, led to chaos at the international airport as thousands sought to flee the country. Let's begin with the ongoing evacuation efforts there, Hamid.
Before answering your question, let me declare my message on behalf of this holy day, the 10th of Muharram, which today is. And this day reminds unforgotten events, heroism, sacrifices, and so on in the world and on undocumented history. My message to all human beings and my brothers, my sisters is Assalamu alaikum wa rahmatullahi wa barakatuh. According to your question, so current situation in Afghanistan looks revolutionary. It was Republic Islamic of Afghanistan, and now it is Islamic Emirate Taliban. And it's a little anarchy over the country. And, since last week, starting from Saturday, Sunday, it was a little crowd on the city and a different pace of Kabul look.
Hamid, I understand Taliban fighters are controlling access to the airport. Are foreign nationals and those seeking refuge being allowed safe passage into the airport in Kabul?
Now the security of Kabul airport is with the US, and they just control the military flights from the Kabul airport. Before on the Sunday and on the Monday, it was too crowded on the airport, and they fight on the Afghans that they were on the airplane, and they just hang on the different places of airplane. Unfortunately, about 25 or 30 Afghans were killed during that flights and anarchy on the airport. Now it's under control. There's only flights from military bases, and it's going on in these ways.
Hamid, what can you tell us about the safety of people, including foreigners and nationals alike, of course, amid the Taliban seize of power there?
From my point of view, this journalism committee and the expats are now safe in Kabul. It's not as much worries about their safety. As you know, there was a conference by Zabihullah Mujahid, and they declared that they just gave public forgiveness to all, no worries for anyone in the country, and everyone can just do their activities, but according to the Sharia, which is law and regulation of Islamic.
Right. Now, Hamid, as you mentioned, Mujahid, the spokesman of the Taliban, gave a press conference on Tuesday local time. Could you tell us a bit more about what was addressed in that press conference, that is?
Yeah. Actually, it was 20 years that the spokesman for the Taliban regime, the Mujahid, he was well known among the journalism community and the public, but the first time he came on the screen and he just declared a lot of things on that conference. It was a conference with the full of Afghan journalists and foreigner journalists, fortunately. And he declared that he just, from the Emirate side, they just gave the public forgiveness, and also for the politician and for the government employees, no worries for them. They just can continue to their work. But also for the journalism community, for anyone in the country, they just have no threat. Everything will be solved in the coming. As their leaders deciding on the type of their government, on the organizational chart, and also he just said about the situation in the country that everything will be controlled or organized soon, and this was the key point that he mentioned on the conference.
Hamid, now prior to the US-led invasion back in 2001, women in Afghanistan had no rights under the Taliban's oppressive rule. How are they reacting to these developments in the country?
Well, it is now we see it's a big change since that years. We see women in the television. We see women's activist women that they are in the
Hamid,
city now.
I'm going to have to interrupt you for a minute right now because we have our regular press briefing on COVID-19 going on at the moment. We'll hopefully connect to you a bit later, Hamid. Is that okay?
No worries, no worries.
All right, Hamid, thank you for now. And to our viewers here, we'll join the regular afternoon briefing on the COVID-19 situation here in Korea for this Thursday.
Okay, that's fine.
접종을 하셨고 And we also have about 21.1% of the population, which is about 10.8 million people being fully vaccinated. And currently, we are also receiving the booking for the general public aged between the ages of 18 and 49. And we see the vaccination reservation rate being at about 60%. And for your further information, we also have about 7.8 million people in this age bracket who have already received their vaccine. And we also have another 1.2 million people in this age bracket who have received their vaccine through the local autonomous vaccination program. And we believe that they should be included in the tally going forward. And also we believe that considering these, we see that about 70% of the people in this age bracket are either willing to get their vaccines or have already received their shots. And let me also go over some global outbreaks of COVID-19. We are seeing an increase of the spread of the virus for the 8th straight week globally. And with the Delta variant spreading fast, we are seeing new cases increasing in the US, Japan, and Israel. And during the past week, we have seen more than 4.4 million new cases globally, and this is an on-week increase, of course. And we also have seen about 66,000 deaths during the past week, and this is according to the data released by the WHO. And as for the US, we are also seeing a new record high in the weekly infections. And starting from early July, they have seen an increase in the hospitalization and also the record high hospitalization for young people. And Israel also is seeing a record high daily tally of over 7,000. And over in Japan, they are seeing an 8-week increase in the new daily tally. And this also the country also has been seeing a new record high of daily infection on the 13th of August. And we have also the Paralympic Games slated to begin on the 24th, which will be carried out without spectators. And they also have extended the state of emergency in the capital area as well as other prefectures. And here in South Korea, thanks to your efforts and also the efforts exerted by the medical professionals, we are also having a containment of the virus to a large extent compared to other countries with high rates of vaccination. And according to WHO, as for South Korea, we have seen about 253 cases per every 1 million cases here in South Korea, while this has been a whopping 2,600 in the US. And as for the fatalities, our fatality stand at about 0.07, while it is remarkably high in other countries, including US, UK. And over in US, UK, France, and Israel, they have been reporting an uptick in the number of fatalities. However, here in South Korea, we are seeing a low level of fatalities and relatively. And also the accumulated fatality rate here stands at about 1%. Which is lower than which is the second lower than the Israel, which stands at about 0.7%. And according to Worldometer, we also have data that says that the weekly tally here in South Korea and the fatalities as well as accumulated fatality rates is relatively low here in South Korea compared to other countries. And in order to further contain the virus spread here in South Korea, it is very important that you get your COVID-19 vaccine shots. And also we ask for your continued participation in the social distancing measures. And next, we also have some measures for the COVID-19 outbreak for the response measures, that is for foreigners residing here in South Korea. And recently we have looked at the foreigners cases, and we have seen about 1,730 cases, which is about 11% of the total cases here. And considering the fact that we have about 3.8% of our population consisting of foreigners, this is a relatively high proportion. And lately we have seen a clear increase in the number of cases, and we believe that our tally has been on a continuous increase by about 7.6 times. And 70% of them, about 90 cases, are clustered in the capital area, while the rest were scattered across non-metropolitan regions. And as for their nationalities, they range from Vietnam, China, and Uzbekistan, and most of them were from Asia. And they were also, majority of them were in their 20s or 30s. And coupled with the increase in the number of infections among the foreigners, we also seen a stark increase in the number of cluster infections involving the foreigners here in South Korea. And considering the fact that they are also exposed to the virus compared to the South Korean nationals, because they have lack of information in terms of COVID-19 protocols, and they are exposed to the 3C environment for a very long time. And there are also many people who are hesitant to get the COVID-19 testings due to their visa status and registration status here in South Korea. And to this end, the South Korean government will also provide measures, and we will also have campaigns so that they can be informed of these COVID-19 restrictions by the local governments going forward. And next also, as for those aged between 36 and 49, we also will have a special days for the booking for their COVID-19 vaccines. And today, 6 p.m., that is, we will be ending our 10-day rotation vaccination reservation system for this age group. And starting from 8 p.m., we will also begin our late reservation for the COVID-19 vaccines. And we have also seen about 64% of this age group finishing off their COVID-19 vaccination registration. And if your birth dates end with 8, you could also continue to make your reservation until 6 p.m. today. And after the end of the 10-day rotation system, we will continue to open the reservation for additional purposes until the 18th of September, that is. So we ask for you to also utilize these timelines going forward. And we want to once again highlight the importance of getting yourself vaccinated, as this is the most effective way to protect yourself. And in order to contain the virus here in South Korea, it is very important that you get your vaccinations, and also complying with the social distancing is very important. And in order to safeguard the safety and the health of our community, we ask for you to refrain from travel and gathering. We need to come to a halt in order to stop the virus from spreading. And during the summer holiday season, we believe that there are many people who have traveled to crowded destinations. And if you have returned from these holidays, we ask you to get tested as soon as possible. And during your daily routines, you are also exposed to COVID-19. So if you have any clinical symptoms of COVID-19, please get tested as soon as possible. Please abide by the quarantine measures and also the vaccination rollout as well. We thank you once again for your continued efforts and participation. We understand that this is a very challenging period of time. However, we ask you to continue to participate in the social distancing measures going forward, and the government will also exert our full efforts to contain the virus going forward. Thank you very much.
Right, that was Peg Young-taek with Thursday's afternoon briefing on the COVID-19 situation here in Korea. And before I turn to Kwon Soo-ah for a summary of his address, I would like to redirect your attention back to Afghanistan, where Hamid Yousafzad is standing by with the latest in the country following the Taliban's rise to power there. Hamid, welcome back.
You're welcome.
Now, before we were interrupted, Hamid, I was asking you about how women in Afghanistan are responding to the Taliban's rule.
Actually, yesterday, a group of women just make a demonstration at the nearby the presidential palace, and they just raised their voices for their rights. They focus that this government should not just should care about the 20 years achievement of this generation, and this is the women's activity in these days. Starting this week, actually, there were no women on the streets, but after the Zabiullah Mujahid press conference, this kind of stuff happened. Social media activities actually in the street, demonstration, this kind of stuff.
I see. Meanwhile, Hamid, the World Health Organization has warned that the collapse of the government in Afghanistan will worsen the country's COVID-19 crisis, which I understand may be the least of the public's concerns right now. But what can you tell us about the pandemic situation there?
Yeah, coronavirus is a forgotten issue in Afghanistan in these days. The people do not care about the preparation of the coronavirus. It's something forgotten in this heroic situation in Afghanistan. You know, it is revolution in the country. It is conflict in the country. The peoples want to leave the country and just go to other countries. It's immigration. It is anarchy, and it is the COVID-19 is totally forgotten. Even the people in the street, I observed, they do not wear any mask in case to just prevent the progress of COVID-19.
I see. Hamid, the international community is seeking to better address the situation in Afghanistan. As a person who's observed what has happened there at ground zero, what do you believe are the urgent needs of the people there right now?
Women's rights achievement, human rights, and also the government achievement. It is their focuses in the last demonstration on the social media, that they should focus on these issues in the country. And the people of Afghanistan in this situation want peace and want world to just focus on Afghanistan, on this heroic situation.
I see. All right, Hamid, thank you very much for making the live to join us at this particular time.
Most welcome. Yeah,
right.
Take care. Most welcome.
Right, now then, I have our Kwonso here at the desk with me with a summary of Pyeongtaek's afternoon briefing. Right, So?
Right, Sunny. And he spoke quite a lot about the situation abroad, saying that for 8 straight weeks, global infections have been on the rise, including due to the surge of the Delta variant in cases in countries like the US, Israel, and Japan. He also mentioned that there's been a high number of foreigners infected here in Korea, with 1,379 people testing positive between August 1st and 14th, which is 11.1% of new cases in that period. But foreigners make up just 3.8% of the nation's population, which is why local governments will make sure that there are special vaccine programs for these foreigners.
I see. All right, so as always, thank you very much for that.
My pleasure.
작년부터 코로나와 싸우면서 학교 내에서 다양한 방식으로 또 창의적인 방식으로 방역 안전 시스템이 잘 갖추어져 있습니다.
Efforts are underway to ensure a safe learning experience within school grounds amid the prolonged pandemic, but debate and concerns continue over the risk of widespread infections, especially in light of the Delta variant. For more on this, I have Professor Park Ki-nam from Gwangju National University of Education. Welcome back, Professor Park.
Nice to see you again.
I also have Professor Lee Hun-sang from Yonsei University. Welcome back, Professor Lee.
Thank you for having me today.
And Professor Park, I need to apologize. I think I made a mistake with the pronunciation of your name. You have Professor Bang Nam-gi from Gwangju National University.
Okay, thank you. It's okay.
Right, and joining the session virtually is Dr. Sajid Chaudhry at the University of Central Florida. Pleasure to have you with us, Dr. Chaudhry.
Thank you for having me.
Right, we'll start here in the studio then. Professor Park,
Yes.
what has been the impact of the prolonged pandemic on the academic arena?
Yeah, COVID-19 has significantly disrupted the normal paradigms of education. Like you know, in-person classroom was no longer possible. And sadly, we expect, but the remote learning was not good substitute as of now. So, but educators around the world have stepped up their efforts to provide high quality instruction to the best of their ability. And in Korea case, the rapid response through CARIS means Korea Education and Research Information Service, and EBS helped the online education of school. And teachers and students have adjusted quite well compared to other countries, I believe so. But we found out that there are quite many the online learning weaknesses. I named that way, such as students from vulnerable class, and underachieving students, and low motivation students, and K-3 graders. So the government is designing policies to help them.
Right, and in simple terms, Professor Park, what makes in-person learning important even amid the pandemic?
You mean the meaning of learning? They come to the school.
Right,
What's the
offline
important?
classes.
Yes, there's two things. One is about academic achievement, and another is the social skill problems. So according to the 2020 National Level Academic Performance Assessment Research, the rate of underachieving students increased. So for example, 8th grader English case, the rate increased 8.7%. It's quite tremendous. And 11th grader Korean case, the rate increased 7.7%. And recently, according to OECD, if we don't make up this kind of the academic underachieving, lifelong income maybe decrease around 3%. And they said also GDP will be decreased around 1.5%. But on the other hand, the more important thing is about social skill problem. So social skills of students are not developed well as of now. So all the society and the parents are worried about that. So under the present education technology level, online education cannot substitute, like we know. And many students still need to be in classroom with teachers and with their friends for the academic and the social ability development.
Right, of course. Now, Professor Lee, speaking as a doctor then, what are your thoughts on the opening of school grounds under the guidance of unvaccinated teachers?
So it is not a easy matter because of the current situation with the vaccines shortage in Korea. But I think in principle, I think it is really necessary for teachers to be in priority for the vaccinations because they are providing the educational service. So they need to be protected, first of all. But also, if they are infected, because many of the children are unvaccinated, they can be the one who can spread the virus. Also, when students are exposed to the infection, then those students can spread the infections, COVID-19 infection to their home. So to protect the teachers and also to protect the children, I think it is really important to put a priority for the vaccination of the teachers.
Right. Meanwhile, over in the US, Dr. Chaudhry, what is your stance on the resumption of offline classes amid the surge in COVID-19 cases involving children there?
Well, this is the worst surge we have seen in US since the start of pandemic. On Wednesday, Florida, which is the hotspot of USA, we had over 23,000 new cases in just one day, and the highest number of deaths within last week, over 1,000 deaths, which makes about 41,000 total deaths during the pandemic, and close to 2.9 million cases total in Florida. And now we are seeing that this Delta variant, which is 99% cause of infection in Florida at this point. And we are kids which are not vaccinated, and we are opening the schools. And in Florida specifically, the government has stop the schools to mandate the mask wearing for the kids. We are expecting highest number of kids being infected also, and especially during this surge, and they're being admitted in the hospitals. So cases and numbers are going up, and I expect that situation is not good, especially in Florida here in US.
And given that situation, Dr. Chaudhry, do you believe that offline classes should resume, or do you believe that remote learning should be an option here?
As we all know that the pandemics happen once in centuries. None of us living today on the earth has witnessed the previous pandemic, which was in 1918, which was the flu pandemic, Spanish flu, called Spanish flu. So people, they are not used to pandemics. They cannot imagine the impact of the pandemic. To prevent the pandemic, the basic principle is to prevent the source of infection for spreading to the other people. And the only way to prevent is to prevent the social closeness to each other. So the mask, no handshake, social distancing, those are the all basic principles to prevent any communicable diseases. So with this in mind, now with the opening of the school, we are actually inviting the more cases and the kind of creating more spread in the pandemic and the more cases. So definitely, I believe, as a medical person, the opening of the school should have been delayed for a few weeks at least to calm down the situation. And also the mask should have been mandated for the school kids even.
Right. Professor Park, there are some who are concerned about possible gaps in learning among children in different regions here in Korea as COVID-19 restrictions differ depending on where you are. Are you concerned?
Actually, it may sound a little strange, but the disparities in the access to school among schools in different areas may help ease the educational gap. It's really strange. The reason is, let's see the statistics. Year 2019, the rate of underachieving students of a small town and the metropolitan schools were about the same as 3.4% and 3.6%. But year 2020, the gap become really widened. From the metropolitan is just 6.2%, but the small town is 9.6%. So schools in the remote area are usually small sized, and most of them can have in-classroom education under the pandemic. But then what I expect is that disparities in access to in-classroom education may ease the education gap because the metropolitan hard to go to school. But it doesn't mean that we want to neglect the metropolitan students. What I want to say is we have to concern about is making sure the most vulnerable students, such as students from low-income families of the metropolitan schools, can continue to succeed. And students with learning difficulties are the ones who are most likely to suffer from the lack of in-person instruction. And I think more efforts need to be done by local government and school districts on offering a safe educational environment for them.
Of course. Dr. Chaudhry, based on what you've observed in Florida, what can you tell us about the safety of schools there against COVID-19?
As I said, that vaccination is the biggest achievement that we have during the pandemic against the spread of the COVID-19 disease. And we see the difference nowadays, like as I said, that 23,000 more new cases. More than 90% of the new cases are among the unvaccinated population. And the vaccinated people, patients, they have an advantage, and they have less chance of acquiring the disease. Or even if they acquire the disease, the less chances for the hospitalizations. They develop the mild disease, but they can spread the disease to the other people. So that's the issue of the problem. So regarding the schools, we expect that within next maybe a few weeks, CDC is going to recommend vaccination for the children below 16, I think up to 12. So that will help if the kids are vaccinated. and then they go to back to school for the learning. Probably that will help to prevent the spread of the COVID-19 pandemic disease.
Right,
Is
hopefully.
it okay? I want to ask him one question.
Of
brief
course,
question.
Professor Park, go ahead.
Your statistics in Florida make us quite scared. So I want to know, in school, teachers and students really keep in the social distance rules, wearing masks, don't talk or make the rule distance, and don't shake hands. So I want to know, even though they keep the rules, still it's like that, or they don't follow the rules well.
Well, there's a discrepancy between what should be done and between the government of the governor of Florida. So governor of Florida has stopped the schools for mandating any mask wearing for the kids. So it is optional. At this point, the kids is optional for the parents if they ask their kids to wear the mask or not. Same with the social distancing, they try to, but it's not mandated. Their kids are not vaccinated. So there's a highest number of the kids being infected at this point. Certain counties, they went against the government and they mandated the mask in their schools. But there is a kind of a conflict and dispute going on between the politicians and the school districts.
I see.
So we don't know what's going to happen, but as you're right, that probably there should be a uniform policy and the clear message going to the public, to the schools, to the kids.
All right. Thank you very much.
The conflict in messaging is probably confusing members of the public there as well. Meanwhile, Professor Lee, what are your thoughts on the risks of Delta infection within classrooms?
So I think with this Delta variant, because it is more contagious, the infectivity has been estimated to be 7 to 1.8 times greater in Korea, in Korean data. So there is clearly some of the concern about the situation in the school settings. But still, I think if the masks are worn well, then there is clearly much reduced level of the transmissibility of the COVID-19, even though it is Delta variant. So, and also another aspect is in the school, we may be able to have relatively controlled environments compared to having students at home. Then the level of the mask wearing can vary, and also when the students are not in school, sometimes the students might be able to might be mingling in other settings as well, in the playground, or the family may be able to go more in the restaurant and park area. So having students in the school might be able to provide them to be in more relatively controlled environments, especially as long as the students are wearing the mask and as long as the teachers are wearing the mask as well.
Right. Professor Park, as Dr. Chaudhry mentioned, the 3 C's to avoid amid COVID-19 are confined, crowded, and close settings, close contact settings, that is. Now, having said that, what can you tell us about student density at Korean schools and perhaps ways to enhance the situation there?
Yeah, it is not like what we expected. According to the Ministry of Education, the number of class with more than 28 students per class is more than 40,000, which accounting for near 20% of all classes. So it means quite dangerous. And the number of students per class must be around 20 to enable social distancing. And the percentage of crowded classes, which means more than 20 students per class, may be more than 2/3, I believe. So it is possible to provide resolve crowded classes immediately. It's impossible because we need more classroom and more teachers. So the immediate solution is the one that alternating classroom system means half of students go to school in the morning and half of students go to school in the afternoon. Then maybe that is one way. And the other one is another way to solve that is, I will talk about that one later, but anyhow, the Seoul Metropolitan School Government is considering introducing the system that I mentioned. But in the long run, classes with more than 20 students per class are likely to be divided in this manner, I believe so.
Right. Meanwhile, Dr. Chaudhry, you spoke of vaccinations for those aged 12 and above. Now, this reality has raised concerns about the possibility, that is, of myocarditis within teenage boys. Could you first start by telling us a bit about what myocarditis is and whether vaccinations for children 12 and above is indeed safe?
You are absolutely right. It's a very valid question and valid concern among the parents regarding the myocarditis, pericarditis, especially in the young population. But if you weigh the risk and benefits between acquiring the COVID disease and having the severe infection as compared to the pericarditis or myocarditis is nominal or minimal as compared to the risk having the disease. As I said, at this point, in Florida, all ICU beds are occupied, and hospitals are overwhelmed with the COVID-19 patients. In our hospital, more than 50% of the patients' beds are occupied by the COVID-19 patients. So more and more kids are getting infected. The mortality and morbidity is way more as compared to pericarditis or myocarditis with vaccination.
Right. Professor Lee, what are your thoughts on mandating COVID-19 vaccinations for school teachers and related staff?
I think there can be some of the concern about some of the teachers who might be worried about being vaccinated, but as much as possible, I think it can be. I think it might be make sense to mandate the vaccinations of the teachers. Again, as I said before, to protect the teachers themselves, but also to protect the children, just in case if there is any situation where the teachers are infected. I think it can be considered sound policy.
Right. Professor Park, some parents are calling for the right to decide themselves whether or not their children will go to school. What are your thoughts on this?
So the MOA has decided to expand the homeschooling under parental responsibilities without help of the school from 40 days to 57 days. It's almost more than like the 2 months, so more than half. But what parents want is offering online teaching even though school opens. So that's the troubles there. So I think the parents should be given a choice until the pandemic has subsided. But the problem is, like you know, we don't have enough teachers or enough money or enough facilities. So we have to find out the solution. So what I think is there's like the one way to solve this problem is allowing students to take classes from online school. We have online middle school and high schools. They offer same curriculum, so they can attend the school. And another thing is using e-class LMS and teaching system offered by the CARIS. It has a program named On the Live. So I use that program. It's quite wonderful. On the Live was enabling students at home can attend in classroom teaching through online, and it has 5 cameras, and which shows teacher and their friends and blackboard and some materials together. So they feel as if they are in the classroom. So maybe we can use that technology together. It will be another option. Yeah.
I see. All right, Professor Park Nam-gi, thank you very much for your insights today.
Thanks.
Professor Lee Eun-sang, thank you for being with us.
Thank you for having me.
And Dr. Sajid Chaudhry over in the US, thank you very much for being with us today.
Thank you, my pleasure.
Right now, whether it's within school grounds or beyond, let's hope for a quick return to the life we once knew, where children can run and play and learn with little concern about COVID-19. Thank you for watching.